Hello, my name is Imari, and today I will be doing a video on inserting and removing a NG tube. I'm going to start off by gathering my supplies, so I'm going to go and get my supplies and come right back. Okay, here we are. Hello, my name is Imari. I will be your nurse for today. I'm going to start off by getting me some hand hygiene. All right, I'm gonna ID my patient. So, Mr. Smith, if I could get you to tell me your first and last name and your date of birth. All right, thank you, Mr. Smith. Do you know what day it is, Mr. Smith? All right. Do you know about what time it is? Okay, and do you know where you are, Mr. Smith? Okay, thank you for that information. Now I'm going to provide you with some privacy. And today we are going to be inserting and removing a NG tube, right? I'm going to make sure that I'm standing on the same side as the nasers chosen and help the patient to a high Fowler's position. And I'm going to place the pillow behind my patient's head. Then I will take a towel and make sure I place it over Mr. Smith's chest. I will keep a box of facial tissue near. And then I'm going to determine the length of my nasogastric tube. And by doing that, I'm going to measure the distance from the tip of the nose to the earlobe, from the earlobe to the xiphoid process of the sternum. Now I'm going to wash my hands and apply some clean gloves. Then I will also apply the pulse oximeter device and measure my patient's vital signs. I would hand my alert patient a cup of water if my patient is able to hold the cup and swallow. I would explain and then insert the tube. I would insert the tube gently through the nostril to the back of the throat. I would aim downward toward the ear, and I would have my patient relax and flex his head toward his chest after the tube has passed through the nasopharynx. As I'm inserting the tube, I would encourage my patient to swallow, taking small sips when possible. Then I would advance the tube as my patient swallow. I would rotate the tube gently 180 degrees while inserting. Please breathe and swallow during the procedure, Mr. Smith. Do not, I wouldn't advance the tube during inspiration or coughing. Each time my patient swallows, I would advance it until it has reached the desired length. I would make sure I take my pen light and tongue blade to check to be sure to make sure the tube is not positioned in the back of my patient's throat. I would anchor the tube to the nose with a small piece of tape, keep the tube secure, attach the syringe to the end of the feeding tube, and obtain gastric aspirate, access amount, color, and quality of the returned gastric fluid. And then I would measure my gastric pH. making sure my tube is anchored to the nose with the fixation device. I would avoid pressure to the nares. Mark the tube at the exit with indelible ink. I will wrap the bottom end of the tape to the tube as it exits the nose. I will make sure that the end of my nasogastric tube is fastened to my patient's gown with a piece of tape. Make sure my patient's head is elevated. Head of the bed is elevated at a 30-degree angle. Remove my gloves, perform hand hygiene, and help my patient to a comfortable position. I would also obtain an order for a x-ray of the chest and the abdomen. After proper tube placement is verified, I would measure the amount of tube that is external and mark the exit of the tube at the nares. Then I would apply clean gloves, administer oral hygiene for my patient, clean the tubing at the nostril area, and then I would remove those gloves, dispose those gloves and my equipment, and perform hand hygiene once again. Hi, Mr. Smith. I'm back again. My name is Imari. I will be your nurse today. I'm going to have you, I'm going to wash my hands first. And now I'm going to have you tell me your first and last name and your date of birth, please. Okay, thank you, Mr. Smith. I'm going to provide you with some privacy. And today, Mr. Smith, I will be removing your nasogastric tube. All right. I'm going to make sure my patient is upright in the high Fowler position unless contraindicated. I'm going to just have a disposable pad or towel on my patient's chest. I'm going to disconnect the tube from the feeding administration set and cap the end. Then I'm going to remove the tape or tube fixation from patient's nose and gown. I'm going to have my patient take a deep breath and hold it. I'm going to kink the end of the tube securely and smoothly and dispose properly. I'm going to offer my patient some tissue to blow his nose. I'm going to clean my patient's nares and provide oral care. And then I'm going to lower my patient's bed to the lower level, raise my patient's rails, and make sure my patient's needs are met. And then I'm going to make sure the call light is within my patient's reach. I'm going to open my patient's curtains back, and then I'm going to wash my hands again. Thank you, Mr. Smith, for your time.